What's up guys, Tom here, and today, as promised, we're going to be talking about how long COVID-19 seemingly lasts on surfaces and what we can do to go and disinfect and kill it. So as we discussed in the previous episode, the coronavirus is made up of a bowl of fat, a bit of protein, a bit of RNA and some other things, which forms its structure and its crown spikes. As the Spanish translation of the name suggests, with corona meaning crown in Spanish, the proteins that make up this crown spike allow COVID-19 to attach to many different surfaces, whether it's your skin, lung tissues, spleens, as we discussed in the previous episode, keypad FPOS, door handle, whatever it is. But just how long does it last on these surfaces? Well, according to a study that came out in the New England Journal of Medicine, I'll put all of the journal details in the description below for anyone who's interested. The scientists estimate that the coronavirus was detectable in aerosols for up to 3 hours. So think about if someone coughed and sneezed, it stays in the air as the big droplets and slowly sediments down. Up to 4 hours on copper surfaces, and this is even with copper's natural antimicrobial abilities, which is why it's commonly used in places such as hospitals and aged care facilities instead of stainless steel. 24 hours on cardboard. So think of all the boxes at the grocery shops, all the tissue boxes that you bought, and anywhere between 2 to 7 days on plastics and stainless steel.
I guess hoarding all of that toilet paper, which is wrapped in plastic to last me for 20 years, wasn't such a good idea.
And then of course there's been studies that have come out since this one, and they suggest that the numbers might be a little bit off and that it could be anywhere up to 9 days on those surfaces, though the general consensus is that it's about up to 7 days. The study also suggested that the COVID-19 virus is actually much more stable in both the droplet form in the aerosols, as well as when it's on the surfaces than its predecessor SARS virus back in the early 2000s. And of course, the study concluded that this reason played a significant role in how COVID-19 was able to infect so many people so quickly, in the fact that it actually persists on surfaces, and it was somewhat resistant to the common cleaning agents that they may have been using, say in a grocery store or anywhere else. I mean, just think about it. If someone infected was at the shops and they had a bit of a sneeze and they shot up into the air, you could walk along 3 hours later, you could still get infected through those aerosols. Just think about the person who always wipes their nose on their hands without cleaning it, and then they touch, the FPOS keypad to put their pin in. No one cleans it for a couple of days. You could come in, you could get infected. Just to kill the mood a little bit further, there's a study that was recently released by the CDC, which looked at a hospital in Wuhan, China, where they went around and tested a lot of the surfaces in a few of the wards and other areas of the hospital, looking for if there was any COVID particles that could be found. Well, the results were less than ideal, as I'm about to discuss, but just FYI, they were looking to detect the COVID-19 particles. It didn't really specify whether these were living particles or just bits of protein that detected. The study found that the areas of the hospital that were looking after the COVID-19 patients, namely the ICU ward and the general medicine ward, they were able to detect viral particles in those areas on a number of their test results on various surfaces, and this proved that it was able to escape the rooms that the patients were in, and it was able to be in other areas such as the doctor's lounge, the nurse's station. The largest concentration of COVID-19 particles seemed to be on the floor of the hospital wards, which is in line with what the scientists originally thought, in that if COVID-19 is a droplet virus, it eventually will sediment from the air onto the ground, hence why you'd get a large concentration there. The unnerving part of that statement is when they went and tested all of the hospital workers' shoe soles, they found that 50% of them returned positive readings for having COVID-19 particles stuck on them. And this allowed it to get spread throughout various other areas of the hospital, including even the hospital pharmacy, which in other words would never have any contact with patients or nursing staff or doctors otherwise.
I mean, gee, this virus knows how to get around.
But it's not all doom and gloom yet. Scientists are still unable to discover what the actual infectious dose of COVID-19 is, which infectious dose pretty much just means the number of viral particles that you would have to take in before you actually get an infection. These statistics are really only here to give us an idea of just how long the COVID-19 virus actually lives on surfaces and in the air, and pretty much reinforces that we just have to be very vigilant with disinfecting surfaces and our hands. But what actually works to clean surfaces and clean our hands? Luckily for us, I found a stability study which tested a whole bunch of common household items and tested their effectiveness on actually disinfecting. This study comes from the Journal of Hospital Infection, and again, all of the details will be in the description. It basically popped a whole bunch of different coronaviruses into separate little test tubes, dropped in a couple of drops of the household ingredient, and it just tested just how long it could detect the virus. Obviously, any sort of reduction in the virus that could be detected resulted in a reduction in viral activity. And just to reiterate, they did use a whole different variety of coronavirus strains such as SARS and MERS, as well as a few others. They did this and collected the data so that they could extrapolate and make pretty much an educated guess of how they would expect COVID-19 to fit in with that data. In other words, they haven't tested COVID-19 yet because it was done a bit too early and they couldn't get their hands on it. So, let's run through some of these ingredients. Ethanol was first up on the list, which is your common alcohol sanitizer, and if you were lucky enough to have any alcohol sanitizer between 62 to 95%, well, you're in luck. At all of those concentrations, it actually works quite well. If you leave it on surfaces or your hands for about 30 seconds to 1 minute, there was a significant reduction in viral activity. Generally, they kept their best recommendation in line with what the World Health Organization recommends, which is to have any sort of alcohol sanitizer above 70% for surfaces or your hands.
I guess that's why the hand sanitizer ran out quicker than the toilet paper.
Secondly on the list is sodium hypochlorite, which is commonly known as your household bleach. Bleach is a very powerful disinfectant and it worked really well against a whole different bunch of viruses. Generally, they found that the best concentrations to use was 0.1 to 0.5%. Generally, most people would be diluting their bleach at home, say 1 ml in 100 ml of water, which usually equates to about a 0.05% concentration. So you can see that that's probably a little bit low and it did recommend to be higher. So in that case, if you were wanting to go down that road, you could always just change the dilution and use 1 ml of bleach to 50 ml of water or 1 ml in 25 ml of water and make it a bit more concentrated. Just please keep in mind that bleach actually stains pretty much everything, so if you go down that road, just be smart about it. I don't want to wake up one day and have all these hate comments in there about how your house has gone purely white. Hydrogen peroxide was another common disinfectant that was sold out just as quickly as the alcohol sanitizers. It worked quite well against the few strains of viruses that they tested it against, although the researchers did admit that it did depend on the actual volume of the hydrogen peroxide that they poured in, so we'll just have to keep that in mind if we use it as a disinfectant. Also, peroxides do stain as well. Similar observations were noted for povidone iodine, which is commonly your wound antiseptic, whilst other disinfecting agents that would commonly be found, say in disinfecting wipes, I'm thinking benzalkonium chloride here, or chlorhexidine washes, they didn't fare as well and they were proved to be ineffective. So just to summarize, ethanol, bleach and hydrogen peroxide would work fantastically at cleaning all of your household surfaces.
Well, if bleach and peroxides will stain my surfaces, and alcohol sanitizers have a street value in line with illicit drugs, is there anything else I can use?
Well, how about regular old dishwashing liquid? Dishwashing liquid, like other hard soaps, act to break down that fatty outer layer on the surface of, say, molecules or viruses or other bugs, breaking that down and then cleansing away all of the other stuff that's on the inside. This is how they generally would, say, clean our dishes or clean our hands when we would normally use them. Well, as I said before, COVID-19 has a ball of fat, that's what it's made up of on its outside, so it has been shown that using soaps would actually strip away that layer and expose all of the viral proteins and content on the inside, and neutralize all of those as well. Soaps also have a secondary action where they actually make a lot of surfaces quite slippery, and then that actually prevents the whole virus sticking to your skin or surfaces and helps minimize the spread of the infection that way as well. That's pretty much why you get that really chemical sheen and feel on your hands as well as the smell after you use them. So these would be great substitutes to use without going crazy on the others or if you can't find any of the other ones that I mentioned. In fact, even hospital guidelines would state that you should use an ethanol sanitizer on your hands in between seeing patients or going from room to room or ward to ward, but if your hands are visibly soiled, then you should resort to using just a plain old bar of soap. Well, there you have it, folks. That's all of the literature up to date that I could find currently on COVID-19 and how long it lasts on surfaces and what we can use for disinfection. I hope you guys enjoyed the video. Please drop a comment below stating what you did like about the video, what you didn't like, anything else that you would like to see me do or any feedback you want to give me. If you're interested in seeing any more content like this, please remember to smack that subscribe button down below with the notification bell on. I hope you enjoy the rest of your week. Go and remember to share a laugh with someone, and I'll see you in the next one.